Hi everyone, Jack here, rheumatology physio, and really excitingly, if you find these things exciting, which I do, NICE have just released guidance on the diagnosis and management of gout. Super interesting for me, obviously, as someone with an interest in all things arthritis, and gout is a type of inflammatory arthritis. So what we're going to go through in this video is just the diagnosis and investigation component of the NICE guidance. There's some really interesting points in there, can be really quite specific with what you're doing when you suspect gout. And these guidelines say we should suspect gout in anybody with rapid onset, and this is quite often overnight. So I always think about an inflammatory pattern where symptoms are worse in the second half of the night, especially waking the patient. So to consider that pattern. And this in gout is often severe pain with redness and stiffness in one or both of the first MTP joints. Then a slight difference is we're going to consider gout rather than suspect gout, and I'll leave you to define down those two things in your clinical reasoning. But we're going to consider gout with the same symptoms, but in all the other synovial joints of the body. So the ones mentioned are the midfoot, the ankle, the knee, the wrist, elbow, and the hand. It then goes on to say that we should be assessing for the possibility of there being a septic arthritis or another type of inflammatory arthritis. So think about those patients with multiple inflamed joints. Maybe they've got rheumatoid arthritis, psoriatic arthritis, or something similar. And sometimes patients do present with gout, but with chronic inflammatory symptoms. So just keep gout in your mind when someone presents like that. It's not always rheumatoid arthritis. So for me, the real take-home message from this section is think about the onset of symptoms, this sudden onset, often at night, quite often the first MTP joints. This is where we're going to see the majority of gout with those kinds of symptoms. So then we go on to diagnosis and investigation. The suggestion is that we need to be measuring serum urate level, and this is going to help confirm our clinical diagnosis. So think back, we've gone, I suspect this person has gout because they've got a sudden onset at night of a red, hot, swollen joint in the first MTP. And there's nothing else to make me suspect it might be a different type of inflammatory arthritis, a septic arthritis, or an acute injury. So we're going to do the serum urate level to add some weight to this clinical diagnosis. We're looking for a level of greater than 360 micromole per litre. But if it's below 360 micromole per litre, then we're going to redo that test at least 2 weeks after the flare of gout has settled. We should consider joint aspiration with microscopy in anybody where we're still a little bit unsure as to the diagnosis of gout. And then finally, it goes on to say if we can't do a joint aspiration, or it still remains uncertain as to whether the patient has gout, then we could use imaging modalities such as X-rays, ultrasound or CT to examine the joints as well. So really quite specific in the guidelines here from NICE, really good, really like it. I think certainly putting on those symptoms, mapping those symptoms onto the serum urate level is a really useful way of doing it. I think the main problems we're going to have is when we've got clinical uncertainty with other types of inflammatory arthritis. And we really need to keep our suspicions high if someone presents, especially with multiple inflamed joints, that it might be a different type of inflammatory arthritis, such as rheumatoid. And these patients may well warrant a referral to rheumatology to confirm that clinical diagnosis. I hope you found this video useful for the signs, symptoms and investigations of gout. I'll put into the comments below the link to the full guidelines so that you can read it. Please do get in touch if you've got any questions or any content you would like me to cover regarding rheumatology, then let me know. I'll do my best to create those videos for you. And I've got lots more coming, loads of interesting papers been out recently. I'm going to try and keep on top of everything, get that information out to you so you're as up to date with rheumatology as you can be. I'll see you next time.